So today we are going to discuss an important topic in the digestive system diseases or gastrointestinal tract diseases, that is gastritis. So basically, in the stomach, there is the stomach. Okay. There is a lining, epithelial lining, epithelial lining. In the esophagus also, this is the esophagus. So we have sphincter here, esophageal sphincter, pyloric sphincter is there. It is the body of us. Everything is that. So in the gastritis, what will happen? The lining, the epithelial line, okay, is affected. Okay, which is having mucosa. What do we have? We have mucosa, mucus. Nothing but epithelial lining release mucosa. Mucosa is decreased. So due to the decrease of mucosa, so what will happen? The, the stomach will release gastric juice. Gastric juice, like example HCl, hydrochloric acid. So basically it is acidic. What it is? It is the acidic. So gradually if you eat spicy food, okay, or fast food, masala food, okay, what happened? For the digestion of these food, large amount of HCl will release in the stomach. So what will happen? It will digest the food and as well as it will damage the mucosal lining, epithelial lining of stomach. Okay, so this is our body is harming ourselves only. So if it is in borderline, that is gastritis. If it is increases, what will happen? It will take the form of ulcer. So what we call peptic ulcer, urinal ulcer. They are names according to the area of the tract. Okay, so basically, the HCl or gastric juice is increased, so it damages the mucosa due to the eating of spicy food, fast food, masala food, or any sometimes infection. Okay, bacterial infection also, or contaminated food, contaminated water. It may cause damage of epithelial lining. This is also cause gastritis sometimes. Okay, so what will happen? Whenever you eat food is present of some spicy, some masala, anything, what will happen? Burning sensation you will get. You will get burning sensation because the muscle is lining up with epithelium to protect the muscle from the damage. So the lining is affected. So there's the reason you are getting burning sensation. Okay. So what are how many types of ulcer gastritis are there? Let's discuss. So basically there are two types of gastritis. One is acute, already you know it. It is chronic. Okay. In acute, it is sudden onset. In chronic, we have different uh, different from the past months, years. Okay, acute gastritis, we have three types. One is simple. Okay, and another one is toxic gastritis. And third one is you have phlegmonous gastritis. Phlegmonous gastritis. What is simple gastritis. It is due to the indigestion of, I already told, the lining of gastric substance, the lining of epithelium is damaged, but in small manner. So it is uh, reversible, and it can be, the damaged tissue will be repaired. Repairing of damaged tissue is there. In toxic gastritis, what will happen? The patient or any person take animal poison or toxic substance, chemicals, okay, pesticides, okay, for the purpose of suicide. Okay, they will take all these things, toxic substance or poison. What it will do? It will highly alkaline. They are not acidic, highly alkaline. Okay, due to the alkalinity, it becomes toxic and it will decrease the amount of oxygen to the tissues. Okay, so the toxic, this due to this alkaline nature, the tissues, the cell will not get proper amount of oxygen, so what they will die. So due to that reason, the epithelial lining is damaged. Okay, so what are those things we will discuss here? The toxic gastritis, the toxic gastritis, they are like examples are salicylate, salicylate. Okay, and another example, most common example is alcohol, alcohol consumption, large amount of alcohol consumption, or any infection also, like streptococci. Okay, streptococci is one of the infection. Okay, and another type of infection is pneumonia also, and viral infections. The bacterial infection, viral infections like measles, hepatitis. Okay, so all this will leads to toxic gastritis. So what are the symptoms in the toxic gastritis? So mostly is burning sensation. Patient have severe burning sensation in epigastric region and fullness of abdomen. Okay, fullness of abdomen, nausea. It is the clinical features: nausea, vomiting. Okay, and sometimes diarrhea also, fever, chills, everything. Really, headache, and the lips become very dry and sometimes bluish. Sometimes blood vomitings will also seen, and blood in stool also seen. All this is due to the, according to the toxicity, the effect will happen to the body. Okay, that's the reason what, like the whenever a person take poison or anything like that. Okay, what they do, they will wash the stomach. Stomach washes the stomach wash with minimum 2 to 3 liter of NS normal saline, okay, to reduce the effect of toxic material. Next, we have third type already. I told you that phleg phlegmonous gastritis. Phlegmonous gastritis. Okay. In this, what will happen? They are most dangerous poisons affect the gas, affect the our in our stomach, like acid. silver nitrate, arsenic, etc. Okay. Or septic infection. Septic infection is also cause of like gastritis. Okay. In this large amount of vomiting will happen, vomitings in this condition. Okay. Other symptoms are similar like toxic gas. So these two needs hospitalization and careful observation to treat the patient. Okay. So here we will not discuss that. Next, we have chronic gastritis. All patients will suffer chronic gastritis. In the chronic gastritis, we have localized, generalized. First is local or general. It is meant by local or general. So basically, it is occurred in the any part of the stomach or small intestine or large intestine. Sometimes general means in whole abdomen. Okay. It occurs in any part. If here general, this occurs in any part, and maybe esophagus, stomach, every part. It may be more than single or double. Okay. Or some patients will have history of gastrectomy, okay, duodenectomy, okay, appendectomy. All this due to the other reasons they will have chronic gastritis or removal of gallbladder. All this you can see. Okay. In that the person will have discomfort, burning sensation in this condition also. Burning sensation, discomfort whenever he need specific spicy food, masala food, anything. Regurgitation will happen. Okay. Regurgitation, constipation. Okay. One main symptom is burning sensation. So whenever a patient complains, I have burning sensation in my stomach, you can directly you can diagnose the gastritis. This is the basic or simple gastritis. It will be acute, it will be chronic. So you need to take the treatment for the gastritis and avoid all the diet. Diet here, the diet is very important. The gastritis or ulcer is specific, it is more severe than gastritis. It will take the form of wound, okay, in the GI tract, GIT tract, okay. But gastritis is only like inflammation of the gastric mucosa. Okay, so here diet is very important. More than treatment, we need to control the diet. Okay, so it is very important. What type of diet you have to advise the patient? Okay, it is very important. So we complete avoid of spicy food. Spicy food, masala food, okay, and junk food, all have to be avoided. Okay, and whatever food it is irritating the person is to be stopped. Irritative food, what I will call irritative food. After eating that food, his digestion is not happening. He is not getting proper stool. So some patients or some persons doesn't like some food. After eating that food, they like the food. Sorry, they like the food, but after eating the food, the amount of digestion is not happening properly, or they have constipation. So their stomach will tell about that food. If you know you doesn't take that food, it will not digest. So your stomach will advise you what type of food you have to take. So that irritative food You start immediately. If you want to cure, you have to stop. Okay. And proper drinking water, drink proper water. Okay. Minimum according to weight. Okay. 3 to 4 liters of water needed per day. Okay. And take proper amount of fruits, salads, and vegetables. Not and another problem is that everyone want to take fruit, or salad, vegetables. You need to take one type of food every day, then another type of food another day. Don't take only one type of food every day. So this will also cause irritativeness. Okay, because our stomach is having multiple types of digestive enzymes. So the stomach also need different types of food for digestion. Okay, so you have can take mixed type of foods. I probably suggest you that you can take one fruit, one day, one vegetable, one salad, one vegetable. So then another type of food, then another type of food. So you can make the timetable. Okay, it will help. Sometimes due to the gastritis, the anemia will happen. Okay, severe weakness is there. Okay, and the patient will have low BP because the intake is decreased. That's the reason. Okay. Now comes to the part of treatment. In the electrohomeopathy, there is simple treatment. Okay. I properly advise S1, L1, WE, start with B5, or if it is acute D6, chronic D4, S10, L1, PE here, because for burning sensation, inflammation. Okay. Here you can take B5. And third one is you need to heal. This is curing group. Next healing group, you need to take C10 also. C10, here you took B, you can take G here. Okay, there are chances of having infection or infection. Or this is C10G, and there is another remedy. It is very important. It is C15 1Y. Okay, for stomach, for any type of infection, or decrease the CVR. You can take in deep. Okay. So this is the basic and simple prescription for the gastritis. You can also use in ulcer also ulcer. But here main thing is that the diet is very important. And if the constipation, you can have as last word 2 plus Y, okay, or C10, sometimes C10 or S10 also. Yeah. This is in deep. Okay. This is about the treatment plan of gastritis, and you can also use in ulcer. So basically, I will not go deep in the ulcer part because already there is, this is the updated form of gastritis, nothing but ulcer. It is gastric ulcer. If it is happening in stomach, duodenal ulcer. If it is happening in duodenum, esophageal ulcer. If it is happening, esophagus. Okay, these are the things you have to understand. If it is not treated, the ulcer, it will fail the form of wound, and then if it is not treated, it will become sometimes carcinoma also. Okay. So this is very important to treat gastritis in early stage. It's all about the gastritis. If any doubts, kindly ask.